In this video, I'm going to talk about minimally invasive lumbar decompression and discectomy. This is a procedure that I offer to patients, especially when they have problems with sciatica, shooting pains down the legs, or spinal claudication, which means difficulty when they're walking any distance with pains in the legs. And often they have low back pain as well. The procedure is a real advance, I think, on the old-fashioned approach, which would be an open discectomy or an open decompression. And in that approach, much of the surgery involved removing muscle from the bone and making a wide exposure to allow the operation to happen. With the minimally invasive surgery, we can work instead down what's called a tubular retractor system, so a tube about 2 centimeters in diameter, and that gives me all the exposure I need to drill away the bone, to remove the ligament that's causing compression and any disc material that's causing compression, and then to close up, and the patients can make a really quick recovery, can go home the same day and be up and about. So it's a really excellent procedure in terms of speed of recovery and in terms of minimizing the amount of damage and trauma to the ligaments. So on the day of the surgery, I'll meet with you beforehand to go through things once more. You'll meet with the anaesthetist, and then you'll come up to theatre where you'll be put to sleep. So once you're asleep, you'll be lying on the table on your front. I'll go in at the back and I will remove a little bit of bone, a little bit of ligament to make more room for the nerves so that they're not being pressed on. And then if need be, I can also remove any disc material that's slipped out from between the bodies of the vertebrae in the spine. Once all that's done, and that takes maybe between 45 and 60 minutes, we'll wake you up, see how you are in recovery and that you're all right for pain. Once you wake up from the general anaesthetic, I'd want you to get going as soon as possible. So I hope to get you out of bed on the same day. Some people will even go home on the same day. Others will wait overnight and go home the next morning. That would be typical. In terms of the recovery from there, you're going to be sore in the low back around the operative site for a few days, up to a week or two. And then that gets better really quite quickly. And then I would hope that you'd be driving and back to work within 6 weeks, up to 3 months if you do anything very physical at work. In terms of the risks of surgery, this is routine surgery that we do a lot of. As with any surgery, it's possible to have infection or bleeding afterwards in a small proportion of cases, 1 to 2%. It's also possible to have damage either to the membranes over the nerves, causing something called a CSF leak, or to the nerves themselves, 1 or 2% at most in terms of that latter complication. Overall, although this is major surgery, I consider it safe surgery. I think if your back problems are interfering with your life, this is surgery that could potentially be a real game changer for you. And I would urge you to consider it as one of the options.